Hey everyone, as a reminder, next week will be the midterm exam. The format is short answer and essay, and it will be made available on Sunday at the usual time. It needs to be returned to me using the link in the assignments folder no later than Friday by 8 o'clock Eastern Time, and more information as usual is available in the syllabus. Okay, this week we're going over substance abuse treatment, which is one of my favorite topics. I will admit up front that I'm rather opinionated about these issues, and here's my bias. First, as a social worker, we are trained that client self-determination is the foundation of our practice. And yet, when I was doing drug and alcohol treatment, every time I put together a treatment plan for someone, it always started out with abstinence, regardless of what the client wanted. We don't seem to quite get the contradiction that in all other areas we can say, start with where the client is at. And yet when it comes to drug use, we start with what I say goes, and what I say is that you have to abstain. Now don't get me wrong, for many people abstinence needs to be their treatment goal, but for many others there may be different options. In fact, most people who abuse drugs or alcohol resolve those problems with no treatment at all. This is something called spontaneous recovery. The most common approach to treatment is called the 12-step model, which is based on the acceptance of oneself as an alcoholic and abstinence before success will be seen in other life areas. I think that's a useful approach, but it's easy. And I don't mean that the clients are easy, but what you do is easy. Just follow the 12 steps of Alcoholics Anonymous. And when it doesn't work and a client fails, then we blame the client because they just weren't ready to change. I think that we have to be very careful using this approach because one size does not fit all, and in my experience, most treatment programs approach it that way. Okay, that's enough of the soapbox. I'll be interested in hearing your thoughts about this as well. Don't forget about the exam next week, and of course, get in touch if you've got some questions as you're preparing. I'll talk to you later.